Good morning, everybody, and welcome to Great Day Houston. It is Wellness Wednesday, and we are in Sugar Land, where Dr. Shel wants to help get you well from the inside out. We're talking about losing weight, balancing your hormones, getting a better night's sleep, getting rid of wrinkles, you name it, she's got it. So let's go inside and find out how she does it. Great Day starts now.
Get ready for fun. Get ready for laughs. Get ready to have a great day. Live from the KHOU 11 studios, it's Great Day Houston. And now here's your host, Deborah Duncan.
Good morning, Dr. Shel.
Good morning.
Let me just first say, when you first walk in here, you don't feel like you're walking into a doctor's office.
That's right. I think part of the experience has to be a place where you can just let go and feel completely serene and calm and peaceful and rejuvenated all at the same time.
I want to back up and talk about how you came to this path, because you're an OBGYN.
Yes.
I say that all the time.
Yes.
But even you had trouble after having your second child and didn't know what was wrong.
I felt terrible. I had fatigue. I had insomnia. I had weight gain. I just could not lose it. I had irritability, mood swings, and I just kind of felt really low.
Hair loss?
Oh gosh, hair loss. Both of my patches gone on each side. I didn't want to leave the house. So when all that happened, I went to my OB-GYN, who happened to be a friend of mine because we worked together, and I said, I really think my hormones are completely imbalanced and we need to do something. And she said to me, now, Shelena, you know that you probably are just depressed and tired and you need a sleeping pill.
Here's some Prozac, too.
There you
right?
go. So would you believe, I walked out with a prescription of Prozac and Ambien, and I thought to myself, this is not the deficiency I have.
We're medicating symptoms, not finding out what the problem is.
That's right. So when I went through it, I realized that as an OB-GYN, if I'm going through this and not finding answers, what's happening to the millions of women out there? So I set myself on a journey which I knew was going to take me to a place where I can help millions of women.
Speaking of that journey, let's take the journey to
Yes.
talk about how we can look good and feel good.
That's right.
All right. Dr. Shel, this is an amazing technology here.
Yes, absolutely. And we have Miss Edwards here.
This is called Vanquish Me.
Vanquish Me, and it is a great radio frequency technology that heats up the fat and gets rid of it permanently.
Yeah, okay, I just started this, right?
Yes, you did.
And I can already tell a major difference, but you have seen a monumental difference.
I weighed 198 pounds.
Wow.
So, yeah. So, as part of my New Year's resolution, I did 3 things. 1, made food program changes. 2, exercise. And 3, vanquish. Why vanquish? The fat is gone.
Down by
56 pounds.
Nice. So Miss Edwards is now doing her inner and outer thighs, where she's done her abdomen, her brothels, her love handles. All of that is already done.
All right, modeling agencies will be calling.
Yeah, there you go.
We saw heat technology in the first room, but this is cold technology?
Absolutely. So you really have to know which is best suited for each patient, because we've got cool sculpting, which is freezing the fat, and then we've got Vanquish Me, which is heating up the fat. We are actually using 2 cool sculpting devices so that we can address 2 separate areas of the patient. We're going to be using the Cool Mini, which is great for the chin fat.
She's also using it on her tummy, but let me ask you something. When
Yes.
you have that fat cell go away, it's not as puffy.
Yes.
So does the skin start to sag, or can you address that
That's
too?
a great question. So most people still have good collagen and the skin will just retract. If you are much older, perhaps in your 70s or 80s, then we do have other skin tightening technology, which are lasers, very safe, very effective, that can tighten that skin up for you.
Dr. Shel, another thing you are adamant about is giving us the best skin possible.
Absolutely.
A lot of women have what's called melasma after pregnancy, or just, it can be hormonal, right?
Yes.
And it's a discoloration of the skin, basically.
Discoloration of the skin, darker spots that just won't go away. So this is the Photonus QMax laser that does an amazing job with melasma as well as tattoo removal. We can do rejuvenation, large pores, fine lines, wrinkles, skin tightening, really lift up that skin and make it really rejuvenated and make you look 10 years younger with no surgery, no knife, no downtime. This is Botox that we're injecting right now, and we are relaxing the glabella, which is what's going to take away her 11s and make her look nice and relaxed at all times.
And this lasts about?
This will last anywhere from 3 to 5 months, depending on each individual's metabolism.
And for some people, it's to get rid of those wrinkles. For others, is to not cause the wrinkles with that repetitive motion.
It can be preventive as well as treatment-oriented. It's also fantastic for migraines.
All right, I see some more machines in here. What's going on?
So what we have is this is our L-therapy machine, which actually is fantastic for skin tightening. Then we have the Hydra facial device, which uses enzymes as well as a lot of other things that we're infusing.
Okay, I noticed a couple of frown lines right here. So, sister, you're going to have to move it on over. You look good. You look good. Okay, all right. Every woman for herself, right? All right. So, you just go ahead and
Make a little frown. Okay. There you go. Are you comfortable? Okay, let's make a frown. And here we go. And one more. Big stick. Voila! With this, 2 to 3 days, and you'll see the difference.
All right, so we got looking good taken care of for the most part. But looking good is not good if you don't feel good.
You have to feel your best. I think it's all about starting at the inner wellness and getting that vitality back.
All right, so what happens in these rooms over here?
So what we do in these rooms is it's a fantastic area for complete inner vitality because we're addressing energy, immune support. If you go around the room, we've got this wonderful patient here doing a Myers cocktails, which is great for the immune support, fatigue, as well as adrenal fatigue. So over here we have the Athletic Performance IV, and we have Mr. Craig here, who is an Ironman.
Oh, wow.
Yes, so he does a great job with being very, very athletic, and this helps him a great deal. Ms. Marchand, who's getting the vitamin C IV, and what did you think, Ms. Marchand?
I have a lot more energy for sure, and just quality of life altogether, so I'm a big advocate.
I've been with Dr. Shel now for a couple of months, and I can't believe how much better already that my quality of life has gotten.
I remember you. In fact, the day I came in here, I saw you, and you were so elated because you felt so good, but that wasn't always the case.
Right. I was so excited the day that I saw you, but if you had seen me a couple of weeks before then, Deborah, I was suffering. I couldn't sleep 4 or 5 days in a row, night and day. Nothing I did would bring sleep.
You even were hoping a prayer chain would help.
Amen. That's right. Prayer chain was going on around the world for me, but someone told me about Dr. Shel, and my prayer was answered through Dr. Shel.
So we have insomnia, fatigue, weight gain. We have low libido, hair loss.
Getting sick a lot.
Yes, low immune system. All of these things happen, and most women and men don't know what's going on. So we look at the hormonal balance by looking at hormone testing, by doing saliva testing or blood testing. Look at food sensitivities, which Miss Owens had. Look at nutritional deficiencies, because it's important to know which vitamins and minerals you're deficient in. And we have tests for all that.
Another thing we want to make point of is that bioidentical is very different from synthetic.
Absolutely. So bioidentical stands for biologically identical to what our bodies produce.
Our bodies think they're like doing a great job
exactly.
at it.
It goes back to nature. And so with the synthetic, you've got risk factors, heart disease, breast cancer, strokes.
I had migraines with synthetic.
Yes, and so you really need to go natural all the way.
We mentioned bioidentical hormones. Yes. There's different ways to deliver them.
Yes. So we can go with transdermal, which is topical on the skin with the cream. Great absorption. And then there's a great way, which is pellets. Grains of rice size little implants that we actually place in. They can be pellets of testosterone and estrogen. It can last up to 3 to 6 months depending on which one we're using and if it's males or females and what the levels are.
It's really your body calls on it when it needs it.
Yes, so it actually releases with your cardiac output.
I work a lot and didn't want to exercise, and I actually started feeling like I was getting a lot of weight gain as well. So I came to see Dr. Shel. Luckily enough, we did a whole hormone panel, and my mom's always suffered from this stuff as well. And I just felt so much more energy. I slept better at night, and just, it was nice. I actually enjoyed being with the kids at the end of the day after a hard day at work.
So what we have here is this is one of my favorite lasers, and as a board certified OBGYN, I really focus a lot on feminine rejuvenation. Once you have babies, things just get looser. With age, things get looser, and you don't have the same sensation, you don't have the same feeling, and you just have lower libido.
You've lost that loving feeling.
You've lost that loving feeling, Deborah.
Believe it or not, we only touched on a few of the things that you do.
Just the tip of the iceberg, Deborah.
But one thing I want to mention before we go is your supplements, because so many of the things that we get over the counter, we don't really know what's in it.
That's right. So I've done a lot of research on my own and self-formulated things with the use of really great labs, our own supplements, as well as things that are just medical grade. Nothing on my shelves is going to be anything but medical grade, so it is regulated.
Yeah. Okay, I'll be right back. I'm going to go to my car and get my sleeping bag because I'm going to move in here. All right.
You're more than welcome to, Deborah.
Dr. Shel, thank you very much.
It's a pleasure.
But most of all, from all the people I know I've spoken to who said, I walked in these doors not feeling good, I walked out feeling good and looking good.
There you go.